Hello everybody, I hope you're doing well and welcome back to my another video on my channel, and I hope that you will give me a subscribe and like. So let's go on with our next topic. It's on hyperdontia, or you can say supernumerary teeth. So what it means, basically define hyperdontia, is that it is an extra number of teeth within the oral cavity of normal or abnormal in shape. Okay, so other than, we know basically that deciduous teeth, they're total 20 in number, and permanent dentition, they're total 32 in number. So if you have a teeth other than this, okay, other than the normal number of dentition, okay, this is basically called as supernumerary teeth. Okay. And let's go on with the causes. There are various causes, but the famous and the most common cause in which supernumerary teeth may be associated, may be linked with, is Gardner syndrome, Ehlers-Danlos syndrome, and cleidocranial dysplasia, and the golden hour syndrome. Okay, so these are four most common disease syndrome in which supernumerary teeth is seen. Okay, there may be other cause also. Okay. So how by supernumerary teeth or hyperdontia? We basically classify them in various form. Okay, so the most famous one is based on the shapes. So here you can see first is supplemental. What you mean by supplemental? It means an extra teeth that is normal in shape. Normal in shape means normal morphology. It resemble either incisor, canine, premolar, molars. Okay. And the second type is tuberculate. Tuberculate, it basically mean an extra teeth with a barrel shape. Its shape is like a barrel. Then after that you have conical, which is peg shape. Okay, this is mostly seen in the lateral incisor of the maxilla. Okay, most common. You call it also as peg lateral. Then after that you have compound odontoma. This is a condition in which you have a multiple small tooth-like structure, okay, within the bone, alveolar bone. And you have a complex odontoma, which basically mean a disorganized mass of dental tissue, meaning there is no proper alignment of enamel, dentine, and pulp. They're basically mixed up, okay, scattered, okay, they're mixed up into a gnarled, this mass of dental tissue. This is called as complex odontoma. The other type of classification is based on position. Pseudodens basically is an extra teeth that is present between the two maxillary central incisor. Okay, paramolar, it means extra molar. Okay, or fourth molar. Okay, fifth molar. It can be. It depends on the number. Okay, distomolar. You have parapremolar. Okay, so this is basically based on position. Okay. And the other class is orientation within the alveolar bone in the oral cavity. Okay, how it is positioned. Either it is positioned vertical or inverted, or either it may be horizontal. And we can classify on based on numbers, like either they are single supernumerary teeth or they may be multiple. And multiple, okay, the further two types, either it is associated with any syndrome or it is not associated with any disease or any other syndromes. Okay, so meaning it is isolated form. Here there's a pain extra teeth. Okay, in the first diagram you can see here many normal shape multiple supplemental teeth. Okay, you see these are all extra teeth. Okay, they're extra teeth, supernumerary teeth. And the other diagram you can see here a mesioden. Okay, this is present between the two maxillary central incisor, and you can see how its shape looks like. Okay, it's a conical shape, a peg shape. Okay, conical in shape. supernumerary teeth, first, it depends on the number. Okay, the more the number, the higher the consequences. Okay, so first is aesthetics. Okay, and the second most common is crowding, because there's no room, no space for extra teeth. Okay, in the alveolar bone. So what happened? There is crowding of the dentition, and they can cause other kind of problem. Okay, so what is extra teeth hyperdontia? First, it depends on the number, the position, the requirement. Okay, so either it can be no treatment. Okay, if it's in a proper alignment. Okay, there's no any consequences, no any complication, no any problem. Okay, so you can either leave the hyperdontia, or you can do extraction. Okay, and you can do surgery. It depends if it is impacted or it is not impacted. Okay, so if it's not impacted, it's fully erupted. Okay, you can do extraction. If no, then you have to do surgical removal of the impacted hyperdontia. Okay, you'll try to give incision, you'll raise the flap, remove some bones. Okay, and then create a pathway for the removal of the extra teeth. Okay, so that's all about supernumerary. Okay, and hope to see you in my next video. So see you soon. Thank you. Take care.